Are Basset Hounds prone to hip dysplasia? Basset Hounds are undoubtedly one of the most adorable and popular dog breeds, known for their distinctive long ears and charming droopy eyes. However, just like any other breed, Basset Hounds are not exempt from certain health issues, and one of the conditions that can affect them is hip dysplasia. This article will delve into the topic of whether Basset Hounds are prone to hip dysplasia, exploring the causes, symptoms, treatment options, and prevention techniques for this condition. To understand if Basset Hounds are prone to hip dysplasia, it is essential first to comprehend what this condition entails. Hip dysplasia is a genetic disorder that affects the hip joints of a dog, causing the joint to develop improperly. It is characterized by the ball and socket joint not fitting correctly, leading to joint instability and potential arthritis. This condition is known to cause pain, lameness, and limited mobility in dogs. When it comes to Basset Hounds, they can indeed be prone to hip dysplasia. While it is not exclusive to this breed, studies have shown that Basset Hounds have a higher risk compared to some other dog breeds. The primary reason for this increased risk lies in their genetics. Basset Hounds are a large and heavy breed with deep chests and short legs. This body structure places additional stress on their hip joints, making them more susceptible to hip dysplasia. Genetics play a significant role in the development of hip dysplasia. If a Basset Hound has a history of hip dysplasia in its lineage, the chances of developing this condition increase. It is crucial to obtain a puppy from a reputable breeder who tests their breeding dogs for hip dysplasia. Responsible breeders will carefully select their breeding pairs to minimize the risk of passing on the condition to the offspring. Recognizing the symptoms of hip dysplasia is vital for early intervention and treatment. Basset Hound owners should look out for signs such as difficulty in getting up or lying down, stiffness or limping after exercise, reluctance to climb stairs or jump, bunny hopping gait, and decreased activity levels. If any of these symptoms are observed, it is crucial to consult a veterinarian for a proper diagnosis. Treatment options for hip dysplasia in Basset Hounds vary depending on the severity of the condition. In mild cases, management through weight control, exercise moderation, physical therapy, and joint supplements can help alleviate symptoms and slow down the progression of the disease. Non-steroidal anti-inflammatory drugs, NSAIDs, may also be recommended for pain management. Surgical intervention may be necessary for more severe cases of hip dysplasia in Basset Hounds. This can involve procedures such as femoral head ostectomy, FHO, where the femoral head is removed, or total hip replacement, THR, where an artificial hip joint is implanted. The decision for surgery should be made in consultation with a veterinarian, considering the dog's age, overall health, severity of symptoms, and prognosis. Prevention is always better than cure, and there are steps that Basset Hound owners can take to minimize the risk of hip dysplasia. Firstly, as mentioned earlier, acquiring a puppy from a reputable breeder who screens their breeding dogs for hip dysplasia is crucial. Regular exercise that is low impact and non-strenuous, such as swimming or walking on even surfaces, can help strengthen the muscles supporting the hip joints. Maintaining a healthy weight is essential for Basset Hounds to reduce stress on their joints. Obesity can exacerbate the symptoms of hip dysplasia and contribute to the progression of the condition. Ensuring a balanced diet and avoiding overfeeding are fundamental in keeping Basset Hounds at a healthy weight. In conclusion, while Basset Hounds may be more prone to hip dysplasia compared to some other breeds, it is important to note that not all Basset Hounds will develop this condition. By carefully selecting a puppy from a reputable breeder, being aware of the symptoms, and implementing preventive measures, the risk of hip dysplasia can be minimized. Furthermore, early intervention and appropriate treatment can significantly improve the quality of life for Basset Hounds affected by this condition.